I'm doing hand hygiene. Hi, my name is Michele Wilson. I'm a Bevel State Community College nursing student. I'm going to do a head-to-toe assessment on you today, which will require me to put my hands on you. Do I have your permission for that?
Yes.
And tell me your name, please.
Desiree.
Hi, Desiree. Can you tell me your date of birth, please?
11/4/1996.
Great. Do you know where you are today, Desiree?
Hospital.
Very good. And do you know what day it is?
It's March 29th and it's Thursday.
Very good. I'm going to get your vital signs if that's okay. I'm going to start with your temperature here. Very good. And I'm going to get your blood pressure, your pulse, and your respirations as well. Very good. Temperature is 98.6. Very good. Here we go. Blood pressure is 120/70, which is very good. And her respirations are 16. I will now check your pulse here. Pulse is 60, which is very, very good, within the normal range. Very good. Okay, now I am going to inspect your head. Her hair is evenly dispersed. The texture is smooth and dry. Very good hygiene. Her hair is nice and clean. No signs of lesions or masses or tumors on her head. Her head is round. Her skull is normocephalic, which is within the normal range. Her skin is even, and it is appropriate. The skin color is appropriate for her ethnicity. Desiree seems very happy today. She shows no signs of distress. Her speech is very fluid. She is very articulate, which shows signs of being a very happy 21-year-old. So her eyebrows are symmetrical, so are her eyes. She's a very beautiful girl. Her nose is midline. Her lips are also symmetrical. Could you smile, please? Very good. No signs of drooping. Her neck also shows no signs of any types of bulges or masses or discolorations. Her skin tone is appropriate for her ethnicity, just like her face. Her trachea is midline, no signs of a goiter, which is very, very good. The temperature on her skin here, on her upper extremities, warm and dry. And again, no lesions, no bruises, nothing abnormal about her skin color. It's very, very nice. Her hands are clean, her hygienes, her nails are clean. She shows no signs of clubbing. If you could put your fingers together here, your fingernails, no signs of clubbing. Her nails are round and the angle is approximately 160 degrees, which is within the normal range, which is very, very good. I'm going to check her pulses here, her temporal, her carotid here and here, her radial pulse. And it sounds very good, 2+ on that. I am going to check her eyes here. Well, while I'm thinking about it, I'm going to go ahead and check her lower extremities here. Her skin is warm and dry here, and the skin color is normal and appropriate to her ethnicity. I see no signs of edema here in her lower extremities, nor do I see any in her upper extremities. I will check her dorsalis pedis pulse, which is very, very good. Now I will move on up to her eyes. I'm going to look. Her pupils are 4 millimeters normally constricted. They constrict to approximately 2 millimeters. I will check her 6 cardinal gazes. If you would, follow my pen here, not moving your head. Very good. Very good. Good. Here and here. Very, very good. If you could look at my pen here and then look over my shoulder, very good accommodation. So Perla, her pupils are equal and round, reactive to light, and accommodate, which is very, very good. I'm going to now check your nose. If you could, cover one side of your nose and breathe. Very good. And the other side. Good. Patency is clear. No distress in her breathing. I'm going to check the inside. The mucosa is moist and pink. No signs of drainage, no deviated septum. And again, no signs of distress in her breathing. So now I'm going to check her ears. And I'm going to pull up and back on the pinna because she is an adult. And her ears are clean, no signs of cerumen. Her tympanic membrane is gray. which shows no signs of abnormalities. Her eyes, again, her sclera is white. Her conjunctiva is pink and moist. I'm going to check her sinuses here. Tell me if there are signs of tenderness. No signs of tenderness. If you could, I'm going to check your TMJ joint, open and closed. No signs of crepitus. Her lips, again, are moist and pink. If you could open your mouth. And her mucosa on the inside of her mouth is pink and moist, so is her tongue. Her teeth are all intact, show signs of good dental hygiene. If you could say ah,
Ah.
very good. Her uvula is midline, and it rises with the ah sound. Very, very good. I did your neck, right? Okay. Did your skin here, so now I'm going to move on to the cardiovascular system. So I'm going to check her chest. And her chest is symmetrical. There are no signs of distress here, and her skin is appropriately colored for her ethnicity. I'm going to check her skin trigger. There is no tinting, no signs of dehydration. So I'm going to check your heart, and when I place my diaphragm of the stethoscope on your chest, if you could hold your breath, please. Okay, let's start here with the aortic valve here. Very good. Pulmonic, Erb's point, tricuspid, mitral valve here, which is the apex, which is where I hear the S1 sound. Up here at the aortic is the S2, which is the base. And the pitch is loved up, which shows no signs of abnormalities, no murmurs, no indication of any type of distress. I do believe, I think I checked your capillary refill, maybe not, I'll do it again if so. Capillary refill is less than 2 seconds, and on your toes, again, less than 2 seconds. Very good. I'm going to check your lungs now. And check your lung sounds. Again, no distress in her breathing. She's breathing normally. Her posture is upright on the bed, which indicates very, very good posture. I can't remember when I checked your hearing if I did the test where I stood behind. I will do it anyway now, since I'm behind you, because I'm going to check your posterior thorax here. So I'm going to whisper a number, and you just say it out loud.
99. 99.
Very good. There's no signs of fremitus here. If you could, take a deep breath. Very good. Her lung extension is good, extends 1 to 2 inches, which is within the normal range. I will now listen to her all 4 lobes on her lungs. And if you could, take deep breaths when I place my stethoscope. And each time I place my stethoscope, she is breathing deeply, and I am listening here. There is no adventitious sounds here in the back, which is very good. Now we'll listen to the front. Here, just take a deep breath here. 1. Very good. Again, no adventitious sounds in the lung area. So as I watch her breathe, she again shows no signs whatsoever of any type of distress. Seems like a very healthy girl. I will now palpate here, and you let me know if you feel any type of tenderness back here as I percuss here on the back. Very good. No signs of tenderness. Now I will palpate here. Very good. Very, very good. No signs of tenderness whatsoever. So the dull sounds are over the organs here, and resonant sounds are good. I will also do the same on the front. I will percuss. Good. Very good. No tenderness whatsoever, and I'm going to actually palpate too across your chest here. No tenderness there whatsoever. Very good. Desiree, if you would, lay flat and lift your knees for me, please. I'm going to inspect your abdomen, and I am noticing that Desiree is a beautiful girl. She has a flat abdomen. There are no signs of bulges, masses, or tumors. No heavy pulsations, which would indicate an aneurysm. So that is very, very good. I am going to auscultate now in all 4 quadrants. Very, very good. There is vowel sounds. There are vowel sounds in all 4 quadrants, which indicates peristalsis, which is very good. I will now percuss in all 4 quadrants, and again, dull sounds over the organs and tympani in the abdominal region. Now, light palpation, which would be 1 to 2 inches pressed into her abdomen. No tenderness indicated, and then deep palpations would be 4 to 6 inches, and again, no signs of any type of tenderness or distress, which is very good. While she's here, I am going to check her lower extremity ROM while she's here. So if you could, let's do your ankles. If you could, let's do dorsiflexion up and plantar flexion down. Very good. I'm going to do it bilaterally. It's very, very good there. I was going to try to think of anything else we could do while you were laying down, but I think that's pretty much it. If you would stand up, I'm going to check your musculoskeletal system. Desiree is a beautiful girl. Her musculoskeletal system looks beautiful. It's all symmetric. No signs of any types of abnormalities. If you would walk for me to the wall and turn around and walk back. Very good. Her gait is even and steady. No signs of imbalance, which is very, very good. I'm going to check now for her Romberg's test. If you could close your eyes. No signs of imbalance and no vertigo, obviously, which is very, very good. We are going to now test your ROM. If you could, we're going to start with your head, your neck. If you could flex laterally here and here, we're going to flex front. We're going to extend and hyperextend there. Very good. We're going to move on to your shoulders. We're going to abduct and adduct here. We're going to move to circumduction here, round. Very good. We're going to go to your elbows. If you would, we are going to extend and flex. Extend. Very good. We're going to move to your wrist. We are going to flex, extend, hyperextend. Now onto your fingers. We're going to flex. We're going to extend. We're going to hyperextend. We're going to abduct, and we're going to adduct. Very good. We are going to move down to your spine. If you would turn side to side to check your spine movement. Very good spine movement. Move to your hips. Now we're going to abduct and adduct. Very good. Very good. We are going to flex up front. We are going to extend, and we are going to hyperextend. We are going to do your knees, which we are going to flex and extend. We have already done your feet. I can't remember if we did your toes or if we did not do your toes. We'll do your toes, which means we will squeeze your toes, and we will extend your toes. We will abduct your toes as well and adduct your toes. Very good. I should have done that to begin with. So next we are going to have you sit down. We are going to check sensation. Did we already do sensation? No? I can't remember. Okay. We will check your sensation here. I'm going to do dull and sharp. Here we go. Very good. Very good. Very good. We are going to check your muscle strength for your shoulders right quick. We are going to press up for your trapezius. Very, very good. 5+ on that. We're going to do your biceps here. Pull towards you. Very good. Now push toward me. Biceps and triceps. Also muscle strength is 5+. Very good. We are going to now check your Brzezinski sign here on the bottom of your foot. And her Brzezinski sign is negative. A positive sign would be the flexing of the toes, which is very good. Also, we're going to do your Grassivia here in your hand. If you could close your eyes and tell me what number I'm making in your hand. Very good. I'm going to conclude with naming the cranial nerves. But first I'm going to, I think I forgot something. I think I forgot the deep tendon reflex. Very good. So I'm going to check your deep tendon reflex here. Very good. Her patellar reflex is good. And her Brudzinski sign is negative. Now, I do believe I'm complete. I'm going to now name off the cranial nerves. So I will start with number 1, which is the olfactory. 2 is the optic. 3 is the oculomotor. 4 is trochlear. 5 is trigeminal. 6 is abducens. 7 is facial. 8 is vestibular cochlear. 9 is glossopharyngeal. 10 is vagus. 11 is accessory. And 12 is hypoglossal. And I'm going to conclude. Thank you for your help. Your call light is right there. If you need anything, you can call me. I'm going to end with hand hygiene right here.